Imagine a condition that causes you to increase your risk of heart disease, diabetes, cancer, sleep apnea, and depression. But a lot of people still see it as just a lack of choice or willpower. Over 40% of US adults meet the standards for obesity. Most people know someone struggling with their weight in this capacity. As someone who has seen friends and family struggle with obesity and diabetes, it puts it into context how it's not that they're just not trying hard enough, but that sometimes they really just can't do it, and it has nothing to do with how they exercise or eat or things of those sorts. Obesity should be treated and classified as a disease so that patients receive evidence-based care, the stigma is reduced, and healthcare systems invest in effective prevention and treatment. So, my first point is that obesity meets the medical definition of a disease. So, obesity involves abnormal fat that inhibits normal functioning. The APA said that obesity is marked by excess adiposity that disrupts metabolic, hormonal, and mechanical systems, increasing risk of serious conditions like type 2 diabetes, hypertension, and coronary artery disease. This will cause a lot of issues with your health, and it's a lot of things that you can't really get rid of on your own. Major medical organizations classify obesity as a disease, which is why it should be. In 2013, the American Medical Association recognized obesity as a disease state with multiple pathophysiology aspects requiring a range of interventions. This means that people need to get the help that they deserve. Endocrinology also classifies obesity as a disease because it's a chronic disease that requires long term management. And it's also addressing the argument of it just being a behavior, because a behavior can definitely play a role, but the genetics of a person, such as their biology, environment, and their psychological makeup, can affect their influence on their weight, just like chronic diseases of asthma and hypertension. This leads into point two: by treating obesity as a disease can improve access to care and health outcomes. Having a disease status can expand the insurance coverage and medical treatment of obesity. By recognizing it as a disease, it can lead to insurance companies to cover counseling and medication for these patients that they desperately need. It encourages physicians to diagnose and treat obesity because by clarifying as a disease, this can lead to physicians monitoring the patient's BMI more and paying attention to their weight regularly, which sometimes they might not do. And then this can help them provide evidence based solutions to help the patient. Also, patients will receive long term treatment plans because since the physicians will be able to diagnose obesity as a chronic disease, they can prescribe nutrition therapy and physical activity plans that could really help the patient to lose weight if they do not have the willpower on their own, and maybe having a plan to do that will help them because it will notify their loved ones that they need to get this help as well so they can keep them honest. And the third and final point is that recognizing obesity as a disease can promote systemic and cultural change. By doing this, it shifts the focus from blaming the patient to also addressing their biology and their environment. This would make the patients feel more inclined to help themselves because they're tired of people just calling them lazy, and it brings into the equation that sometimes they're around a bad food environment where they're only eating unhealthy foods because they don't really have access to healthy foods. And it also promotes that this is happening to them because of stress and genetics. So not all of the focus is on them being lazy and not having the will to do it. It encourages public health and policy responses because by making a disease, government and other forms of leadership will then support policies like making school lunches healthier and promoting community activity and safe rec centers within that community for these people, and a regulation of unhealthy food marketing by not promoting fast food constantly and promoting more vegetables. It also reduces the stigma and supports mental health because by viewing it as a disease, it shows the patients that it is safe for them to seek help because it is not always their fault that they are overweight. And, this is why obesity should be treated and classified as a disease so that patients receive evidence based care, the stigma is reduced, and health systems invest in effective prevention and treatment. It is recognized by medical organizations as a disease and meets the criteria, which is why it should be. Also, the disease status will improve access to quality health care, and disease status can promote the policy change. I urge everyone listening to please choose respectful words when you're talking about obesity because that will help them feel more included and that's not their fault. And also, it'd be good to support the policies to help obesity, just like healthy school lunches and not only promoting fast food restaurants and helping your local town get a park, and also to help others that you talk to, family, friends, whoever you think could possibly be dealing with obesity or not even dealing with obesity, but just bring to light that it's a medical condition and it's really not shameful to the person. Thank you.